Welcome to Designing Healthcare That Cares, the show where we explore how to build healthcare systems where people and performance thrive. I'm your host, Dr. Laura Suttin, a physician, coach, and healthcare leader who believes that human flourishing and organizational excellence go hand in hand. Each week, I talk with leaders, change makers, and innovators about how to shift culture, lead with purpose, and tackle the root causes of burnout. Because when healthcare works for the people in it, everyone wins. Welcome to Designing Healthcare That Cares, the show where we explore how to build healthcare systems where people and performance thrive. I'm your host, Dr. Laura Suttin, a physician, coach, and healthcare leader who believes that human flourishing and organizational excellence go hand in hand. Each week, I talk with leaders, change makers, and innovators about how to shift culture, lead with purpose, and tackle the root causes of burnout. Because when healthcare works for the people in it, everyone wins. Welcome to the Designing Healthcare That Cares podcast. I'm really excited to talk to our guest today is Ellen Whitlock Baker. Let me tell you a little bit about her. She is the founder and CEO of EWB Coaching, which helps professionals learn how to prioritize themselves in a world that often tells them not to. Very cool. With her superpowers of empathy and honesty, she is passionate about helping you understand how uniquely awesome you are and how harnessing your personal strengths can be life-changing. With 20 years in the workplace and a certification in executive coaching through the International Coaching Federation, Ellen helps leaders become the best versions of themselves through expert one-on-one coaching, workshops, and courses. After her own experiences with burnout and self-doubt, her goal is to help others never get to that place. Ellen is also the host of the Hard at Work podcast, which says the quiet part out loud about what's not working in today's workplaces and shares tools to help survive it and change it. Love all of that. Ellen, welcome to the show.
Thank you so much for having me, Laura. I'm so happy to be here.
Tell us a little bit about you and how you got into the place where you are now.
Yeah, I have a long history in working in alumni engagement in higher education. So most of the last 20 years has been working for higher ed, big university, small university, all different kinds, and working on engaging alumni, which is not that different from engaging employees within a workplace. And I think a lot of what I learned throughout my process there and my time there, specifically that if you really want to engage alumni, you have to treat them as a community and you have to ask them what they need and want rather than assume you know. And that rings true for workplaces as well. And, having been a leader in workplaces too, like I see the parallel, and it takes longer to do that work. It is harder to do community-centric work, but the rewards are astronomical, including more efficiency, less loss of income from people resigning or leaving, higher employee engagement, which we know leads to better working products from everybody. So it's been really interesting to see how my life of putting on football parties and like visiting alumni in cities has turned into really this passion about how do we create these workplaces where we are centering the people in the workplaces and asking them what they need and want and adapting the workplaces to what that is. And I really got there from I burned out really hard last year for the first time. I mean, I've definitely been overwhelmed in my life, in my work life, and worked too hard, but the burnout was really, really tough. And I knew I was done. It was the first time where I actually let myself say, you know what, I can't do this anymore because I'm the breadwinner for my family. And so it's always felt like I had to keep working, but you can't when you get there. I mean, it's a medical condition, really. Like you just can't go anymore. So luckily, I had been studying to be a coach and certified to be a coach and just loving that work. And so that's kind of how it's all become what it is now, which is it's so joyful to be able to help people have better times at work because I don't think it should be miserable.
I love everything that you just said. I don't love the burnout part, of course, but the distinction between burnout and overwhelm. And it's not a technical of DSM or ICD diagnosis, unfortunately. I think at some point soon it probably will be. But,
Yeah.
We talk about the emotional exhaustion, the depersonalization, the reduced personal accomplishment. I see you nodding. So it sounds like that's really what you felt. How did you know that that was different from overwhelm or busyness or just life stressors?
It's hard to answer that because I think it was a lot of things at once. I think part of it was I reached an age where I'm 45, so I'm in midlife, I'm in perimenopause. I think for a lot of us at this point in our lives, especially after COVID, we've had this awakening
Mhm.
of maybe I don't have to have this be the way my life is working.
Yeah.
I don't know if you have navigated that
Yes.
too, but most of my
Yes.
clients are women in midlife and it's really common. So there was that happening. And
Mhm.
I was starting to really, really notice that my values weren't aligned with my workplace, which was really a strange thing to get to because
Mhm.
as a type A perfectionist, good girl, I always was like, yes, my boss is great. I'm going to listen to everything they say and it's all great. And to start questioning that started a big journey for me of who am I in all of this? What are my values? Why isn't this aligning with them?
Mhm.
So that's why it's kind of a long story because before I really hit that midlife point, I was overwhelmed, but I was like, well, this is how it goes. You have to work too many hours if you're in an executive level. You've got to feel stressed out. Everything is a priority because it's so important, the work that we're doing, which I look back now and I laugh because we're like throwing parties for alumni. Like it is important to engage alumni, yes, but it's not, unlike you, we are not getting into rooms and like really helping people's health, or
Yeah.
curing cancer or whatever.
Yeah.
So that was overwhelmed for me, but I think it was really once I started to have this awakening. It's like once you see, you can't unsee.
Right.
And so I couldn't stop seeing the stuff that just was feeling really bad at work. And
Yeah.
I got to a place where like I was crying in my car every night on the way home. And I was like, that's probably not healthy. And then I had this epiphany or I don't know, outpouring of emotion. I was at a musical with my family and I'd met them after work. And like 20 minutes into the first act, I just started crying and I could not stop. And it was Beetlejuice, the musical, like not a sad musical at all.
I'm a musical fan, so I was gonna ask you what it was.
Okay. I love
Not Les Mis.
musicals. They usually make me very happy, but it was very odd. And I think maybe it was the dark and the quiet that finally just like let my nervous system let go, or I don't know what it was exactly, but it was scary because I could not stop. And
Yeah.
my daughter was there, but like at intermission, I was still going. Like I just lost it. And I knew at that point in time, I was like, okay, I have to be done. Like I can't
Yeah.
live like this. So
Yeah.
unfortunately, it took a breaking point, and that's where I really want to help other people recognize those signs
Yeah.
before they get there. Cause now I'm healing still. It takes a while to get back from that.
Yeah.
Even though I'm doing something I love, I still am processing all of the things that made me burn out. So it's not like you quit your job and it goes away. It's
Right.
definitely a process.
Yeah. Oh, yeah. 100%.
Did you have you burned out too? I didn't ask. I should.
I can't think of a period in which I could say, "Oh, I was burned out in this period." Mine was a slow burn, similar to you. I'm 47, so very similar, perimenopause, all the things that come along with that, a lot of the energy shifts, life shifts. My daughter going through high school, she's a college freshman now, so that transition and everything leading up to it was a lot, just the big life changes. I got married right at the beginning of COVID, and so, yeah, lots of life changes. First of all, when did we come out of COVID? I felt like that was a very slow Band-Aid being ripped off.
Yeah. Are we out of it?
Yeah, are we? COVID cases are spiking now. It's
I
September of
heard.
2025. There's still COVID. But coming out of the pandemic and lockdown, as much as we locked down in Texas, which is not much, but
Mhm.
really just coming out of that acute phase of stress and seeing, my father passed away during that period also. Okay, what is it that I want my life to look like? And very similar to you, feeling like the organization I was with at the time, my values didn't align. And knowing I had so much more to offer, I really liked the people I was working with. I liked the work I was doing. And I just felt like I hit this wall where I
Mhm.
can only go so far. And I knew that I could go farther on my own if I started my own company. So that's what I did. But yeah, still dealing with what's the phrase, wherever you go, there you are. Like still dealing with that mindset
Mhm.
and trying to deconstruct that mindset for myself. So, what you said, there's a parallel between fundraising and working with alumni. I've not worked as an employee for a nonprofit, but I'm very involved in what's now called Blood Cancer United, formerly Leukemia
Mhm.
and Lymphoma Society. I'm on the local board. So I've been very involved in that for the past 5 years. So I have experience on the volunteer side of fundraising. But I love that analogy between fundraising and connecting with alumni and learning how to do that well, and also connecting with your employees well
Mhm.
and having
Mhm.
them see as a community. So as I hear you spitballing, I'm thinking, okay, if I'm fundraising, I'm going to alumni, I'm essentially asking for money or time or
Mhm.
whatever that looks like. The
Mhm.
same thing of employees. And I've seen this so many times in workplaces where it's a, okay, employee, I'm a boss leader, company culture, whatever. I'm asking you to do X, Y, or Z in return, but I'm also giving you something. I'm paying you. I'm giving
Mhm.
you healthcare. I'm giving you a 401k. I'm doing all these things for you. And I've seen that mentality be like, well, we're paying them. Isn't that enough? We're giving them
Mhm.
great benefits and they can't get these benefits elsewhere. Like we match their 401k up to 3%. Other places only match 1.5. Yeah, seeing you shake your head. So all the data that we now know, I mean, Daniel Pink's got some great data in his book
Mhm.
Drive, and other much more smarter people than me have data around what it really takes to get the best out of people. So I'd love to hear how that evolution has been for you. And you've clearly seen what doesn't work.
Mhm.
And you seem very passionate about it now and doing coaching and speaking and coursework is I've seen what doesn't work. I've seen what does work. And here's what the
Mhm.
data shows. So take us into all of that in your work.
Yeah, I love that. And I think you and I were talking about this briefly, but I think those of us in a service environment, whether it's a nonprofit, public sector, medicine, healthcare, first responders, whatever, I think it's very, very easy to take advantage of employees in those sectors because of the mission based work that we
Mm-hmm.
do. And I want to be careful saying that because I absolutely love mission based organizations. I care about the work that I did. I think there is a piece of everyone who's doing that kind of work that is doing it because they care, because we know we're not getting paid as much as an Amazon employee, and we know our benefits might not be as good and whatever it is, but we care. So we want to do something to help other people.
Mm-hmm.
And I love that. I don't think it should be used to treat us badly in
Mm-hmm.
the workplace
Right.
or encourage us to give more than we should give. And that's where I've really started to see, especially being out of the workplace. But I'm surrounded by people who are either still in it. And, I got a master's of public administration. So a lot of my friends are in nonprofit public sector. It's kind of most of my group. And it is so easy to guilt someone into working more or harder or going above and beyond because it affects the population that you're serving
Mm-hmm.
positively.
Mm-hmm.
And that's just not sustainable. And I think that that's why we're burning out. I mean, all of those fields are burning out so quickly. We've got this younger generation that's like, no, thanks. I'm not going to do that. I
Mm-hmm.
think the average tenure for a fundraiser is 2 years at this point. And that costs so much money. It's billions of dollars a year. Almost $1 trillion is spent by companies to replace employees
Yeah.
every year.
Yeah.
That's a huge number.
Yeah.
So either those companies don't care because they're making enough money elsewhere, or they're just not paying attention to something that will end up being a problem later. For nonprofit and public sector, we need to pay attention right now
Mm-hmm.
because we're losing people left and right. So there's that piece that I'm starting to come to grips with. And I have a friend, Perry Radford, who's doing some work on moral injury for
Mm-hmm.
fundraisers and
Yeah.
sort of really like the actual definition of moral injury and how that applies to the fundraising profession. So that's really interesting too. So there's that piece. And then there's also this piece that's like, we've made it so complicated and it's really not. But we get into a contract with our employer. I
Mm-hmm.
will do these things that you have laid out for me in this job description really clearly to the specifications that you have laid out for me really clearly, like this kind of outcome, metrics, whatever. And you will pay me this much money. The end. It's a transaction. And a lot of us think of it as a relationship or a family or something that isn't really just a black and white transaction.
Mm-hmm.
And I know that there are people who hear that and think that's so callous because you want to love your work and you want to go in every day and be happy about it. And that's just BS. Like, that's not actually going to happen. And we live in a country where it's capitalist. We've got to make money in order to live in this country
Mm-hmm.
and survive. So that's where I think I go back to that. You were talking about it a little bit, but I go back to, can we simplify our relationship with what work is for us? It's a
Mm-hmm.
transaction. It's something we have to do in order to get money to live. And it's something that companies need us to do in order for them to make money. And
Mm-hmm.
it's really that simple. But what I find is when those outcomes, goals, job descriptions, work plans are really unclear, which has been my experience my entire career, that's when that contract is very hard to enforce because you don't know if you're reaching the goals. Your employer doesn't know if you're reaching the goals. And that's where I think some of the really, really bad behavior comes into place in workplaces.
Yeah, that conversation around, is your workplace your family and how do we treat it? And we spend so much of our waking hours in the workplace, and especially in medical communities, healthcare, we
Hmm.
identify so much with our jobs. And I know when I took a break from clinical practice, I really struggled with the identity of, am I still a doctor? Because people would ask me,
Yeah.
what do you do? The Uber drivers, what do you do? Oh, I'm a doctor. Oh, where's your clinic? Would you work in a hospital? Where's your practice? Well, I don't have one right now. And then so you
Totally.
go through, at least I did. And I've talked to lots of others who had the same thing, that we really identify with it so much. And what comes up for me as I hear you is, I've heard Esther Perel. She's known mostly for like sex and couples therapy,
Yep.
but this is out of that context so much. But she talks about how within like a partnered relationship, romantic relationship, we put so much invested or expect so much out of that relationship because we don't have institutions that we for thousands of years had to rely on, which is extended family, religious organizations,
Community.
communities
Yeah.
that
Yeah.
that a lot of us still have in our lives, but don't have the same impact that they
Hmm.
did even 50 years ago. It's the same thing with our work. A lot of times, if we don't have that sense of community or sense of identity outside our work, if we put all of our identity into what we do for 40 or more hours a week, then where does that leave us if something that gets taken away? Or if you and I experience, we start to see like, wait a second, maybe I don't always agree with the people who are making the decisions or the people that
Hmm.
are paying me. And then that becomes, well, am I wrong? Are they wrong? Then we start to question, and it becomes a real challenge internally. We get this conflict.
Oh, it's so hard. It's so hard. And I think that's a big piece with this lost feeling that a lot of us have because our identity has been work for
Yeah.
so long. And those of us who are, I'm right on the cusp of Gen X and millennial, like I'm
Mhm.
right in the middle, but I see kind of both sides. But I mean, look at who like the popular culture icons were. It was like Claire Huxtable and
Mhm.
like the mom from ET and the mom from Ferris Bueller and like all the
Right.
people we saw. The moms worked.
Yes.
Working girl, right? Like they
Yeah.
worked and they worked hard. And we learned to be the first one in the office and the last to leave and wear what your boss wears if you want to get ahead and go above and beyond and work, 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 work. And that's just really changing right now.
Mhm.
And so we've set up our lives that way. And then when you stop, when you realize you don't want to do that anymore, it's like, well, God, what am I without
Mhm.
that?
Right.
Like my whole life, I was like, I'm going to be a vice president. Like that's where I want to go.
Mhm.
And when I got to AVP, I was like, "Oh god, no, I don't want that job,"
Yeah.
because I saw it,
Yeah.
in its current format. That was hard for me because I didn't know who I was without that goal. So I think for a lot of us, there's this like grieving process of giving that up.
Yeah.
And then this process of, okay, well, then who am I without all of that? And then what do I do? And I
Mhm.
definitely have a lot of clients who are in that, what do I do? They're 50 or older. They know they want to keep working but they're, looking at their last job before retirement, maybe, or
Mhm.
second to last. And they know they don't want to do what they've been doing because it's just not working for them anymore. But they're so tied to that identity. It's really hard to kind of, and that's what the work we do together is like we unravel it all to figure out what is really in there for you.
Yeah.
And then how do we apply that to something different? But I think that's really common.
Yeah, and you mentioned it earlier that the younger generation, my daughter, my stepkids that are in that Gen Z, they're not signing that same contract
Oh,
that we that we
sure
did.
aren't.
And all the generational conversations. Well, these young folks don't want to work as hard, and I don't see that. I
Mm-mm.
see they're going to work hard. They want to know that there's purpose behind it. They want to know what the meaning is in their work. They want to feel some connection to the work and the work that they're doing, the people that they're serving, and not just, well, I have a paycheck. Because it used to be there was a promise of a pension and a gold watch after
Right.
30 years, and those promises are dissolving rapidly.
My dad, he's 84 and he was a professor at the University of Hawaii and retired early because he was over it. Like as soon as I graduated from college, he was like, okay, bye. But He has like Cadillac healthcare for life. He and my mom pay nothing
Mhm.
for healthcare. Nothing, not one thing, which is like one of the things that I'm sure you well know. Like, isn't it like the biggest bankrupter in America?
Oh, yeah, medical
You
debt.
know?
Yeah,
And
especially for seniors.
yeah, and because he was a professor and it came with this pension and it came with this, he's like taken care of for life. And
Mhm.
I'm looking at myself, my husband, the rest of like we aren't. Unless you're making a lot of money,
Yeah,
it's really hard to get there
yeah,
now.
yeah.
So it's just such a different relationship with work.
Yeah, yeah. This is so interesting, so fascinating. What are the concrete things you mentioned that there are some really specific things that workplaces can do to bring back that engagement and make their
Mhm.
employees feel seen and heard and cared for and develop that sense of community? So,
Yeah.
if I'm a manager or anybody leading a team in a workplace, what are some things that I could do?
The first thing is slow down, and that's the hardest for everyone. But the work takes time, and to do it well, you need to go to the workers, to your teams, and ask them how they're feeling, what they need and want, what their individual work styles are. Do they feel like their job is clear? Do they feel like their metrics are clear, however we define them? And that takes time. And once you do that, once you hear from them and like really listen, really hear from them, continue that relationship with them where you're getting information and actually doing something about it. Or if you can't, reporting back why. I think there's this like honesty that isn't always there, especially when a worker wants something and we just can't do it for whatever reason and we just never get back to them. Well, then that breaks trust, right? So there's this okay, this is a community, so we need to ask
Mhm.
and we need to change. Treating your employees as individual people and not all as one is something that I'm really passionate about. That's why I don't love return to office mandates. I don't love working hour mandates because we all work differently at
Mhm.
different paces. And it depends on if you're neurodivergent. Do you have a disability, hidden or otherwise? Do you care for an elderly parent or a child and need to kind of chunk up your workday in order to
Mhm.
get to that? In my mind, none of that should matter. What should matter is that you've got a clear contract with your employer. If you're getting your job done, who cares? Where, when, how, why? As long as you're getting it done, that's what matters. And if you have clear metrics, you can be working with a team member who may not be meeting metrics and figure out why that's happening. But
Mhm.
forcing them to come into the office 5 days a week is not necessarily going to make that any better or different. So being willing to pause, asking your community what they need and want, thinking about employees as individuals and not imposing these sort of harsh one size fits all mandates.
Mhm.
And then the other thing that I think is really important, and I learned this from one of my guests, Kira Mosseth, is setting norms for your teams. And it was like when she talked to me about it, I was like, oh my God, why did I never do that? It was such a smart thing. But we were talking about it in the context of like behavioral health at work, and we all process stress differently. I'm a crier. My stress response is to cry. And it took me till now to figure that out. I'm not too sensitive. It's not that I don't have a backbone, it's that
Mhm.
when I feel under stress, that's kind of what my body does to respond. Someone else's stress response might be just to get quiet. If you're in a meeting, how something is affecting someone in that
Yeah.
meeting. And so if you get together and you set norms beforehand that are like, here is how our meetings work. And if anyone at any time needs to leave a meeting because they need a minute or whatever, they go, no questions asked. They don't need to ask permission. Nobody needs to follow up with them. It's just like little tiny things like that that make a huge difference.
Yeah.
So I think that's the other piece. And to me, that goes with the community. We treat
Mhm.
each other as a community,
Yeah.
and that's where you're going to get trust. And your work's not a family, and you don't have to love who you work with, but there's a care of abiding by these shared values that is important.
Yeah.
And so that's where I think, God, we could do so much better. But people
Yeah.
don't want to slow down. I think that's the biggest problem.
Well, you probably hear this a lot because I hear this a lot too, is when I work with clinician leaders, leaders in healthcare is I don't have time to do these things.
Exactly.
There's a perception that it takes so much more time.
Yep.
And first of all, I've seen there might be a time investment. Yes, but that's not your biggest barrier. Your biggest barrier is because you're afraid of what people are going to say. That's what I've seen in my experiences when we would really dig into, okay, why aren't we asking our doctors and our advanced practice clinicians how we can serve them better or what they need from us? Well, we're afraid they're going to tell us something that we don't want to hear. Then we're going to have to respond and say, well, we can't do that because of X, Y, or Z, or whatever that answer is. Or, that's a great idea. Let's look at that. And that's where you're talking about the transparency. And I love
Mhm.
that you brought that up. I've seen it backfire so many times when we ask people for their opinion and
Mhm.
we never do anything about it.
That is the worst thing you can
It's the
do.
worst thing to do.
Yeah.
Yes.
And those employee engagement surveys by Gallup and, a lot of workplaces take them annually. And, in the workplaces that I've been in, they're taken really seriously, by HR. And so, like,
Mhm.
your team's results are a reflection of you. And which, sure, yes, you are
Mhm.
the leader, you're setting the tone for your team, and you're creating the environment.
Mhm.
But a lot of the questions are you answer the survey and then you talk about it once and then you just answer it again next year. And
Right.
there's no, okay, we heard this. And so this is what we're doing. There
Yeah.
might be some surface level stuff like, okay, we're going to add on an extra fun night for
Yeah.
the team, but that's not changing the systems. And we're
Yeah.
afraid to change the systems.
Yeah.
Afraid, and it's hard. It's
Yeah.
really, really hard.
I've also seen people be afraid to put down what they really want
Oh,
and ask
100%.
what they really or
Because
of
it
what they
gets
really feel on the
traced back
surveys.
to them or, yeah.
Yeah, it's
Mhm.
gonna get back to them. I've also seen
Mm.
people being coached in advance on how to respond
Oof.
to the survey. Oh,
Mm.
yeah, I've seen it all. Yeah, I was, talking with another physician leader the other day about something that he had instituted in his organization. He was chief medical officer. They would do exit interviews, but he, again, pointed out the flaws of it is by the time people have decided to leave, it's too late. You can't go back and
Yep.
fix why they left, and they're not invested in it, so they're gonna probably not tell you the real thing of why they're leaving, and so in order to get in front of it is to really ask the people who are there, "What's keeping you here? There's a
Mhm.
hospital across the street, or there's a hospital closer to your house. What's keeping you from leaving here and going to work for them?" And asking very specific questions about what do you need in order to be successful? What can I do for you? What can I do to support you? Really asking and really listening and doing that in a systematic way and then following
Mhm.
up
Yeah.
with the people that give ideas, give suggestions. He said that was game changing in his world. And somebody that he was asking these questions said, nobody's ever asked me this. And this just really makes me feel like somebody cares about me. That the fact that you're
It
sitting down and asking.
does. You're asking me? Oh my
Yeah.
gosh.
Yeah.
Yeah, I agree. And I think that there has to be the right environment for that to work. I think a really good place to do that is one-on-ones. Quarterly, you should be having that conversation with your employee. You should be
Mhm.
looking at metrics or whatever is,
Mhm.
happening. And you should be, instead of saying, well, let's see how you're doing. Here's this, this, and this. We want to change this. And you should just say, how are you doing?
Mhm.
And those questions you just said, that's such a good question. Why are you staying here? What's keeping
Yeah.
you here?
Yeah.
One of the workplaces I was at did something called stay interviews
Mhm.
instead of exit interviews. So similar concept,
Yeah.
but you did not feel comfortable that what you said in those interviews was not going to get relayed
Yeah.
back to your boss.
Yeah.
So there's no point in doing them if you
Yeah.
don't have that really strong trust.
Yeah.
I think you build it first and then you build in some of that. But yeah, I agree.
Yeah.
Those are the conversations we neglect having, and
Mhm.
it's too late when we finally think about it.
Yeah. Definitely that trust has to be built first, for sure. I agree. And yeah, he called them stay interviews and it was the manager talking to their direct reports and
Mm,
having a conversation.
that's where I think it should happen. I love that.
Yeah.
I
Yeah.
love that.
This is so fascinating to talk to you and learn from you. Thank you so much for being here. What else would you like to share that we haven't already discussed?
Oh my gosh, I could talk forever. Well, I would love it if folks wanted to listen to my podcast too. We talk about really similar things, but not necessarily focused on the medical profession or healthcare in general. It would be amazing if, people wanted to follow me on Instagram or LinkedIn. I really like to say what I'm thinking and feeling, and I want to know, if it's resonating, what's resonating. I write articles for Forbes Coaches Council, so you can find me there. And I would just say that I really, really hope that if you're listening to this and you are a people leader, that it makes you do one thing differently. Because I know what it feels like to be in a giant organization where you're in the middle and you can't make sweeping changes. And sometimes, particularly when your job's not protected by a union, you can't.
Mhm.
And so know that you can make smaller changes with your team and create these sort of islands within the
Yeah.
organization or the company, but that it's your responsibility to do it.
Yeah.
I think that as a leader, it's our responsibilities. And even though it's hard, that's part of the job. So, whatever small step you can take it.
I love that. Yes, and we'll include the links in the show notes for
Awesome.
your socials and podcasts and all of that. So thank you so much. It's so great to talk to you.
You are so welcome. And now I get to have you on my podcast so you can hear
Yes,
from her more, more
so
Laura.
excited. I'd love to.
Awesome. Thank you
Thanks.
so much.
Thanks for listening to Designing Healthcare That Cares. If today's conversation gave you a new idea or inspired you to see things differently, share this episode with a colleague and keep the conversation going. And if you're ready to take the next step in building a thriving healthcare culture, you can find resources and ways to connect with me at drlaurasutton.com. This podcast is for educational and informational purposes only. It is not medical advice, and it should not replace care from a qualified healthcare provider. Always seek the guidance of your physician or other qualified professional for any medical questions or decisions.